So the question is, what's the likely impact on the private sector of the ACA? And I think the largest impact on the private sector is in the small group market, a fundamental change in how small groups are rated, how small groups, the types of plans they have, they're eligible to purchase, and so it's becoming a different product for them to buy, and also a different way they're rated. So that's a fundamental change that's going to hit every small business in the state of Maine, and one that I think is going to take some time for people to realize why it's different. I don't think it's either good or bad necessarily, but it's just going to be different. That's a huge change. For the non-group market, the biggest change is going to be the availability of coverage through the exchanges and the complexities of that, the potential for subsidies and whatnot, but also the whole exchange experience. For large group, there's some changes that are in the ACA, but those are smaller and I think more known. The bigger issue for large employers ultimately is going to be how they manage the employer penalties and the employer responsibilities that they will have that are new and different than they've had in the past. I think Harvard Pilgrim's approach to the ACA across markets is to try to do our best to implement the law as best we can, as efficiently as we can, so that we're ready to sell coverage that's effective January 1st and subject to all these things. So within the different market segments, I think they're very different. I think small group, as I said, there's fundamental changes about how we rate and the nature of the products we sell. So I think it's about getting ready, educating our colleagues in the broker community, educating customers as to why they're going to look different, how they're going to look different, and what it really means for them. For non-group, I think while in the past we've been able to service the Dirigo population in the non-group space, we haven't had much in the regular commercial non-group space. So, it's about, and we are going to be off exchange in the non-group space. So, it's about developing those plans and trying to, reach those customers. So that's just a new and different aspect of the marketplace for us. For large group, again, it's really about educating our customers and, often through their brokers, but educating our customers about the responsibilities they have under the ACA and some of the changes that are happening to their plans to be compliant with the ACA. That's really the big challenge in that space. So Harvard Pilgrim is not going to be on the main exchange or marketplace in 2014. I think it's our intention to be on the exchange come 2015, not only here in Maine, but also in New Hampshire. We are going to be on the exchange or the connector in Massachusetts, but we've been on that now for several years since Mass did health reform. And that's a state-based exchange, so it's a little different. The transactional and IT requirements of it are a little different. So I think going long term, we certainly see ourselves as a player on the exchanges and accessing those marketplaces, and specifically the non-group market in the subsidized space. So that's a long-term goal we have. It's just a matter of kind of getting there and all the IT requirements to be able to service it. I think for people who are going to be signing up on the exchanges, I think the only recommendation I can give is they get as much information as possible. It's a different way of accessing health insurance. There's the potential for subsidies and cost sharing reductions, and getting as much help as you can to see what you qualify for and make sure you're getting the right coverage for you, as opposed to just regular off-exchange marketplaces where the coverage is maybe simpler to understand. That's probably the only good advice I can give is just get as much help as possible, because the coverage is going to be slightly different than it has been in the past.